The case of a young factory worker who suffered severe injuries with no compensation. This sets the stage for understanding why we need robust occupational health measures. Definition and core principles. Occupational health is fundamentally about promoting and maintaining worker well-being across physical, mental, and social dimensions. It focuses on preventing health issues caused by working conditions and protecting workers from workplace risks. A key principle is adapting the work environment to fit the worker, rather than the other way around. Workplace hazards. The presentation covers several major categories of workplace hazards. Physical hazards. Temperature extremes can cause various health issues from burns to hypothermia. Poor lighting affects eye health and work efficiency. Noise exposure has both hearing and non-hearing related impacts. Vibration can damage joints and limbs. Radiation exposure poses serious health risks. Chemical hazards can affect workers through skin contact, breathing, or ingestion. Dust particles of different sizes affect different parts of the respiratory system. Various gases and toxic substances can cause immediate or long-term health effects. Biological and mechanical hazards. Workers can be exposed to various infectious diseases. Equipment and machinery pose physical injury risks. Psychosocial aspects. The presentation emphasizes how mental and emotional factors like job satisfaction, workplace relationships, and stress affect worker health. Would you like me to continue with the rest of the content? I can break down the sections on occupational diseases, prevention strategies, and legal frameworks. Disease and health impacts. Workers can develop various occupational diseases, with pneumoconiosis being a significant concern in many industries. This lung condition develops from inhaling different types of dust particles. There are several forms, including silicosis from silica dust, anthracosis from coal dust, and asbestosis from asbestos fibers. Each type has distinct characteristics and requires specific preventive measures. Lead poisoning emerges as another major occupational hazard, affecting multiple body systems. It can enter the body through different routes and cause wide-ranging symptoms from neurological issues to reproductive problems. Both adults and children can be affected, though the impacts manifest differently. Occupational cancer. Various industries pose cancer risks to workers, particularly affecting the skin, lungs, and bladder. The presentation emphasizes the importance of controlling carcinogenic substances and implementing protective measures. Dermatitis and skin conditions. Workplace skin conditions can arise from physical, chemical, and biological factors. Prevention focuses on pre-screening, protection, and maintaining good hygiene practices. Absenteeism and accidents. The presentation addresses how various factors contribute to workplace accidents and absenteeism, emphasizing the importance of proper management and preventive measures. Health promotion and prevention. A comprehensive approach to worker health includes proper nutrition through workplace canteens, disease control through immunization, environmental sanitation including proper ventilation and lighting, mental health support, special provisions for women and children, health education, and family planning. Legislative framework. The presentation covers major legislative acts protecting workers' rights and health. The Factories Act provides basic workplace safety and health requirements. The Employee State Insurance Act offers comprehensive health care and compensation benefits. Prevention strategies. The approach to preventing occupational diseases involves medical measures, including regular health checkups, engineering controls to create safer workplaces, legislative measures to ensure compliance, insurance and benefits. The ESI Act provides various benefits including medical care, sickness benefits, maternity care, and disability compensation. It creates a safety net for workers and their families. Modern workplace considerations. The presentation concludes by addressing contemporary challenges in occupational health, including the need for rehabilitation services and special provisions for different categories of workers. Throughout, the emphasis remains on creating a holistic approach to worker health and safety, combining preventive measures, legal protections, and comprehensive healthcare support. The presentation structures these complex topics in a way that shows how different aspects of occupational health interconnect to protect worker well-being. This comprehensive framework demonstrates how modern occupational health has evolved from historical workplace tragedies to become a sophisticated system of worker protection and health promotion. It highlights the importance of continuing to improve and adapt these systems as workplace challenges evolve. Workplace benefits and services. The ESI scheme provides extensive medical support, including outpatient care, medicines, specialist consultations, diagnostic services, and home-based care. It extends beyond basic medical care to include preventive services and maternal health support. Healthcare delivery. The system implements a comprehensive healthcare approach through accessible outpatient facilities, complete pharmaceutical support, access to medical specialists, modern diagnostic capabilities, home-based medical services, comprehensive maternal care, preventive health services, including vaccinations. Implementation framework. The success of occupational health programs relies on strong administrative structure, clear chains of command, expert medical oversight, professional financial management, regular monitoring and evaluation, modern challenges and solutions. Today's workplace health programs must address complex environmental challenges, communicable disease control, food safety and nutrition, mental health support, accident prevention, social welfare issues, progressive measures. Advanced occupational health programs incorporate worker nutrition programs, disease prevention strategies, environmental health controls, mental wellness support, special provisions for vulnerable groups, health education initiatives, family welfare programs. The presentation concludes by emphasizing that occupational health is an evolving field that must continually adapt to new workplace challenges while maintaining core principles of worker protection and well-being. Success requires ongoing collaboration between employers, workers, healthcare providers, and regulatory bodies. The field continues to grow more sophisticated, incorporating new understanding of workplace hazards and developing more effective preventive strategies. This evolution helps ensure that workers can perform their duties safely while maintaining their health and well-being. The ultimate goal remains creating workplaces that not only prevent harm but actively promote worker health and satisfaction, leading to better outcomes for both employees and organizations. This comprehensive approach to occupational health represents a significant advance from historical workplace conditions and continues to evolve with new research and understanding. Environmental management. Proper workplace environment management encompasses ventilation systems, temperature control, and protection against various hazards. Housing considerations are also vital for worker well-being, recognizing that living conditions impact overall health. Mental wellness initiatives. Mental health programs focus on promoting worker happiness and detecting early signs of stress. These programs include support systems for those experiencing mental health challenges and rehabilitation services for affected workers. Women and children protection. Special provisions exist for protecting vulnerable worker groups, including maternity benefits and leave, healthcare services for mothers, work hour restrictions, child care facilities, special workplace accommodations, educational initiatives. Health education and family planning programs form crucial components of comprehensive workplace health strategies. These programs empower workers with knowledge and resources for better health management. Disease Prevention Framework. Prevention strategies operate through three main channels: medical approaches, including health screenings and monitoring; engineering solutions for safer work environments; legislative frameworks ensuring compliance and protection; factory regulations. The regulatory framework establishes clear guidelines for factory operations and management; safety inspector appointments; medical professional requirements; worker protection measures; implementation structure. The system requires regular inspections, professional medical oversight, clear documentation processes, worker education programs, environmental monitoring, safety protocol enforcement. The presentation concludes by emphasizing that successful occupational health programs require ongoing commitment from all stakeholders. They must continuously evolve to address new challenges while maintaining fundamental worker protections. Modern occupational health represents a comprehensive approach to worker well-being, far removed from the historical cases of worker exploitation that open the presentation. It demonstrates how systematic approaches to workplace safety and health can create better outcomes for both workers and organizations. The field continues to advance, incorporating new understanding of workplace hazards and developing more sophisticated preventive strategies. This evolution ensures that workers can perform their duties safely while maintaining their physical and mental well-being. Success in occupational health requires vigilance, commitment, and cooperation among all stakeholders: employers, workers, healthcare providers, and regulatory bodies. Together, they create workplaces that not only prevent harm but actively promote worker health and satisfaction. Monitoring and surveillance. Regular assessment of workplace conditions and worker health status helps identify potential issues before they become serious problems. This includes environmental monitoring, health screenings, and tracking workplace incidents. Continuous improvement. Programs must evolve based on emerging research findings, new technological developments, changing workplace dynamics, feedback from workers and management, lessons learned from incidents, stakeholder engagement. Success requires active participation from management leadership, worker representatives, healthcare providers, safety specialists, regulatory bodies, occupational health experts. Training and development. Ongoing education ensures workers understand safety protocols. Supervisors can identify hazards. Staff can respond to emergencies. Updated knowledge of best practices. Awareness of new regulations. Documentation and reporting. Maintaining comprehensive records of workplace inspections, health assessments, incident reports, preventive measures, training programs, health outcomes, long-term vision. The ultimate goal is creating sustainable workplaces that protect worker health, prevent occupational diseases, promote well-being, support productivity, foster positive work culture, ensure regulatory compliance. The presentation concludes by reinforcing that occupational health is not just a legal requirement, but a fundamental aspect of sustainable business practices. It emphasizes that investing in worker health and safety benefits both the workforce and the organization's long-term success. This comprehensive approach to occupational health has transformed workplaces from potentially hazardous environments into spaces that actively promote health and well-being, marking significant progress in worker protection and organizational responsibility. Final takeaways and future outlook. Integration with modern workplace. Contemporary occupational health must adapt to remote work environments, digital transformation, new industrial processes, emerging technologies, changing workforce demographics, emergency preparedness. Modern programs must include crisis response protocols, disaster management plans, pandemic preparedness, emergency communication systems, recovery strategies, sustainable development. Occupational health links directly to environmental sustainability, social responsibility, economic viability, community well-being, global health initiatives, quality management. Excellence in occupational health requires regular audits, performance metrics, benchmark standards, continuous assessment, quality improvement cycles. Future challenges. Programs must prepare for climate change impacts, technological disruption, demographic shifts, global health threats, economic uncertainties, leadership commitment. Success depends on clear organizational vision, resource allocation, management support, worker empowerment, collaborative approach. The presentation concludes with a call to action, emphasizing that occupational health is an evolving journey rather than a destination. It highlights how the field has progressed from basic safety measures to a sophisticated system integrating health promotion, disease prevention, and well-being enhancement. The future of occupational health lies in creating resilient, adaptable systems that can respond to emerging challenges while maintaining fundamental protections for worker health and safety. This requires ongoing commitment, innovation, and collaboration among all stakeholders in the workplace ecosystem.